I'm Christopher O'Connor. I'm the CEO and Executive Director of the Inova Heart and Vascular Institute and the Editor-in-Chief of JACC Heart Failure. I'm here at Barcelona, Spain at the European Society of Cardiology meetings. Today we just recently heard an outstanding presentation by Dr. Javed Butler on the EMPA-REG outcome study and a subgroup analysis of this study. As many of you know, EMPA-REG outcome was a study of over 7,000 patients who had type 2 diabetes and cardiovascular disease, 90% without heart failure, 10% with heart failure, and they showed that the drug Empagliflozin reduced morbidity and mortality to a significant degree in this population. This study looked at the patients who did not have heart failure, over 6,000 patients, and divided them into three groups of risk based on the ABC risk score. That is low to average risk, high risk, and very high risk of developing heart failure 5 years down the road. And the question was, did the drug, Empagliflozin, reduce the risk of heart failure hospitalization or death to an equal degree in the low-risk patients as well as the high-risk patients? And why this study, I think, is very important is that this study showed that despite being either low-risk or high-risk, the drug showed equal advantage in reducing that risk of heart failure, hospitalization, or death over the next 5 years. And why I think this is important is that I think this can be implemented into practice, and that is your low-risk patients as well as your high-risk patients will benefit from the drug therapy. And the way that I think we should implement this into our practice is that we should think about this therapy as one that works across the spectrum of risk. In high-risk patients with diabetes who are likely to develop heart failure, and those with low to average risk, this drug benefits patients to an equal degree. And so I think it should be implemented into practice across the broad range of patients with diabetes, cardiovascular disease, whether they're low risk for developing heart failure or high risk for developing heart failure.